Hi, I'm Kendra Andrews,
And I'm Libby Kamrowski.
and we are recording a line of hard work highlighting hospice nurses, particularly one, Judy Cunningham of Horizon Hospice in Spokane, Washington. When we met with her, one of the first things that she said that kind of caught my ear is that she didn't initially want to be a Horizon Hospice nurse or hospice nurse in general, and she was super squeamish, like with needles and stuff like that. And I mean, that's definitely something that I can personally relate to. I am not one for needles, shots, injections, or anything like doctory. So I know I could definitely not do her line of work.
Yeah, that kind of struck me too because personally I'm terrified of needles and I would never want to be in a hospital setting at all.
Seriously.
There's just something scary about hospitals for me at least. But, you know, she started out as a nurse. She said that she didn't initially want to be a nurse at all, it sounded like. And then going into something that's so much more, I guess, rough and tough, such as hospice care. You're not necessarily in a hospital setting all the time, but you are going through a lot more, I think, emotional and psychological burdens than somebody in just the regular hospital setting.
Absolutely.
And she launched into that a little bit.
Yeah.
You know, because hospice deals so much with death, she gets close to her patients. I remember she was, she gave a couple anecdotes about a patient that she was really fond of named Helen.
Yeah.
And, you know, you still get close to patients like that. It's pretty intense one-on-one care. And it's not that typical hospital setting where you have, 30 patients, you only deal with them once a day. And it sounded pretty intense.
Yeah, I mean, when she was talking about Helen, you could just kind of see in her face the way she smiled when she talked about her. She smiled when she was remembering the memories, and she was like, when I went in to do my nurse duties, like half the time they didn't even talk about medicine or anything like that. So you can tell how close they become and with her patients, and sometimes with the families as well. I mean, I think that when you're a hospice nurse, you really are trying to take the burden off the family, and when you do that, you obviously take on a great deal of responsibility, and I mean, you're kind of just taking on all of their sadness, and it's pretty incredible how she, and I'm assuming bunches of other hospice nurses, kind of keep that positive outlook on life. I think that is just something that is so hard to do, especially when you're just surrounded by sickness all the time. And she pointed out, you don't see death every day, but you do see sickness every day, and I can't even imagine kind of going home and trying to leave work at work and home at home. I don't really know if I could kind of leave those two parts of my life separate.
Yeah, and I was just reading the other day, I was researching a little bit on hospice care, and the CDC, I think it was, said the average care span for a patient in hospice care is only 17 days.
Yeah.
So that means if you're like a hospice nurse who's, you're full-time, you're seeing death up to like every 2 weeks, depending on how many patients you have. And, people often think, the hard jobs are the physically strenuating things, like, being a garbage man or, like, repairing things in dangerous places and stuff. But I don't think hospice care really gets enough of that credit, because this has so much more, psychological burden. And we were talking about how do you not take this home with you? And, Judy said that she did take it home with her, and or we also talked to a social worker, and it was the same story. We spoke to Amanda Linder, who is also affiliated with Horizon Hospice, and even though she's not doing, administering, all these like medical things to patients, she's still interacting with them, and she sees that too. She said that she takes it home with her as well.
Yeah, something that really stood out to me when both of these women were talking about, taking it home with them and the sadness. They said, yeah, of course it is sad, but to kind of try and find the silver lining, there is a sense of joy that's kind of with this happiness, in the sense that you are kind of helping them to the next stage of their life, a life where there is no suffering and no pain for them, which I think is it's an incredible outlook to have, and it's definitely just trying to find that little bit of joy and happiness that you can, and saying, I'm helping this person, obtain their last wishes, whatever that is. I mean, I know hospice has kind of like a a last wish program that they do where if you want to meet someone, you can meet someone. If you want to go somewhere, they try and make it happen. And I think for them, being able to fulfill these dreams for these people is pretty rewarding, and I think definitely makes it worth it.
Yeah, and another thing that I kind of found as I was reflecting on the stuff that we did for this story, you know, if you look at like a profession like teaching, you think about how influential it is to shape the minds of young people and to continue to do that and just classes and classes over the course of a generation. This is actually surprisingly similar to that because you have a really big influence on how somebody sees the end of their life as a hospice nurse. If you know, are just really grim, the people are gonna reflect that around you, and it must be really hard to have to keep your head up like that when you know it's gonna happen. They know it's gonna happen, and you see it so much. But you know, people like Judy are actually doing the good work because you know they're comforting their patients. That's pretty much the whole goal of hospice care. It's not to save people, but it's to comfort people. And to make the end of somebody's life as best as it can be right before they pass, it's really hard, but you know, they're doing it.
And something I found really interesting about Judy actually is that, you know, in the beginning we talked about how she didn't initially want to be a hospice nurse, but she did after her father was put in hospice and passed away. And I think that's pretty cool too, because I feel like for a lot of people, after they experience something like that, they want to kind of distance themselves as much as possible because it does touch home. And when there's certain situations that don't bring up great memories for you, you don't want to participate in that. You don't want to, you know, have those trigger moments. But I think it's really cool how she saw what they did for her father, and she said, you know what, like, this sucks, and I know it sucks, and other people are feeling this way too, so I'm going to do my best to try and comfort them, as her father's hospice nurse did for her family.
Yeah, and on a more personal note, it was actually just a couple weeks ago, like, while we were developing this story, my significant other, her uncle, like, was literally in the last, like, 3 days of his life, in the last weekend of his life, and he was actually a patient of Horizon Hospice. I don't know if it was, you know, somebody that Judy was dealing with, but they had the whole family gather, and things like this, it's not just, like, you know, one or two people at a hospital. Like, they make sure that they're comforted by their family around them because it's a planned thing, and they're actually taking him off life support as it was happening because he's had cancer for a while and they knew it was just the very end. But you know, she described that, like, the atmosphere was really loving and not, you know, we're about to be at a funeral, and you know, the people who just work in this field every day have such a big impact on that. So.
I agree. And I mean, a couple months ago, I think, when basketball season was still going on, I was at a basketball practice for the Zags, and there was a hospice patient there, not from Horizon, but from a different hospice in the area, whose biggest dream was to meet the team and meet Shemet Karnowski, and her daughter was there, and her family was there, and you could all just see, and she was smiling, and it was just like the happiest day of her life. So I mean, these nurses are, it's a hard job to do, but they do it with such, like, grace almost, and handle so much that so many people could not handle. I definitely couldn't. So just major props to them.
Yeah.